Hello, everyone. Welcome to the Medicare Space channel. My name is Victoria Cabrera, Medicare insurance agent here with Coverage to Care in San Antonio. Today, I am here with Dr. Mcclelland with Health Texas in San Antonio, and she is going to be helping us navigate through a few things such as telemedicine. I know there's so much information going out there. You guys are getting bombarded with information. And the most important thing is we want to make sure that our seniors are having access to the resources that they need. And by doing that, we want to provide you guys with some value added benefits today to help you navigate through everything you need. And today, Dr. Mcclelland, thank you so much for joining us today. I really appreciate you taking your time out of the crazy hectic schedule. Most importantly, thank you so much for your service. I know you guys are out there in the front lines helping these seniors, helping not just seniors, but everybody that needs help during this process. So I really want to get back to just providing value like you guys have always been, especially with the senior population. I know that something that's very important is that a lot of people have been talking about telemedicine, and you hear telemedicine from the government and on the news and local stations. Can you tell us a little bit about how telemedicine works or what Televisit and telemedicine is?
Absolutely. Thanks so much for having me. A televisit is a method that you can see and hear the patient safely and securely. And we use Helo app here at our group at Health Texas. And during the coronavirus, it's actually usually less expensive for the patient. It's certainly faster, and Medicare is covering their portion of the visits during this time period.
That's awesome. Yeah, a lot of people are concerned because, I mean, obviously money is really tight, and especially it's always been for our seniors. They're on a fixed income, and Absolutely. During this time, it's even harder, I'm sure, for everybody. So that's great to know. I know, like, even for me, I'm pretty tech savvy, and I kind of can navigate through things, but when it comes to picking up the phone and actually trying to figure out, okay, what's step one? How do I actually get on the phone and get this going to to talk to my doctor, or to see my doctor on a telemedicine visit? Can you walk us through something like that?
I can. So how to get the most out of your televisit, you want to kind of prepare for it. If you're able to, get your blood pressure, your pulse, and your weight. As long as it's a safe way, you can do that. If you're diabetic, if you could just check a sugar and have your medications near you. And it would be helpful. You need to have a smartphone, a laptop, or computer. And most systems work better with an iPhone. And most offices want to connect with you 10 to 15 minutes before your visit. And be sure your internet's turned on, either on your phone or your laptop. Answer the phone when we call, and it's usually a certified medical assistant in our group that calls to verify your meds and get your history.
Now, I know you mentioned at the beginning about the blood pressure and the weight and things like this. Would you recommend maybe them having, I know it's probably hard to get, a blood pressure machine or blood pressure. If they already have those things in their house, I mean, would it be safe to say, have it in kind of a little hub in your room so that way you're prepared for your visit? The scale, the blood pressure machine, I mean, are those things that I know through most insurances, they can get those through their over-the-counter benefits. But is that safe to say is that they should have that readily available when they talk to you guys?
Yes, if they could get it ahead of time, that's even more helpful. I've had several patients, they've had to run and go weigh themselves, which is fine. But they're saying, oh, gee, should I run to the grocery store? No, we do not want them checking their blood pressure at the grocery store right now. And I'm hoping those machines are shut down. I think they are. So if they can safely do it at home ahead of time, that would help. And it is a good idea to have that equipment at home. A wrist cuff is a screen, but it's definitely better than nothing. And if they're diabetic and can check their sugars, then it's helpful too. It's not a requirement, but it's just helpful.
Yeah, any information that you guys can provide your doctor to Dr. Mcclelland, if you don't have a doctor and you're trying to figure out, well, heck, I've never even been to the doctor. I'm just super healthy and I don't feel like I need it. But now you actually want to tap into these telemedicine benefits. Dr. Mcclelland with Health Texas is a great resource, and we'll provide the information to you guys, or you can reach out to me and we can get you directly to Dr. Mcclelland. So another thing I know, when you're going through these telemedicine visits, you said that they can use their phone. Is there like an app they have to download?
They were downloading the app, but now if we've scheduled the appointment at least an hour ahead of time, they'll just get an invitation and they just press on a button. So it's gotten so much easier. And some of my seniors they're doing great. So they can just accept the invitation and it automatically loads for them. We just need an hour to do that.
That's great, because a lot of seniors get so stressed out just by, I don't know how to get on my phone, or I don't know how to download this. And, you know, any way we can make it easy for them, it's really awesome. And they don't, to rest assured, everybody, you don't have to be tech savvy to utilize a telemedicine. It's there for your health, to keep you you know, up to date with your health, and to be able to keep in touch with your primary care doctor like Dr. Mcclelland. Is there anything else you want to add to that process on the telemedicine?
Well, and some have used FaceTime for the first time. It's not that complicated, but most of the doctors are blocking their number as they call, because we're using our personal cell phones. And so just remember to be sure and answer if you get a blocked call. And staff's reminding patients, but sometimes they have a tendency to forget. And some have used FaceTime for the first time and they realize it really is pretty easy.
Now, I don't know if this is a question for you, but I know a lot of people are concerned is because they hear so much on the TV, right? The hospitals are, you know, overloaded, the clinics are overloaded, but that necessarily is not true when it comes to seeing your primary care doctor. Are there a lot of wait times with you guys, or is it pretty quick that they can check in with you guys?
It's actually pretty fast. I was blocked out for vacation for Fiesta, and so my availability is really good for these next several days. And so, because we opened up my schedule again just a short time period ago. And so some of us have had vacations planned, and so when we've been unblocking them, then there's more availability. You know, some days it's busy, but it's usually after I've been calling my patients on the weekend saying, hey, you need to come on in.
That's
so
awesome.
Availability is actually easier now for primary care than it has been in a while. And it's exciting when we call the specialist to try to get our patients in. They're like, I'll see them tomorrow. They're so excited to see patients too.
That's amazing. You know, we take for granted that one-on-one contact with people, right? It's just like, now we're going through all this and we're all having to adjust to this. I mean, even for myself, I'm used to being around my seniors, being in their homes, talking to them, chit-chatting, drinking coffee, and it's just a whole different, you know, environment. But the good news is that we have these telemedicine visits now that we can tap into, so you don't need to lose touch with your primary care physician. Now, if you're out there and you're saying, well, heck, my primary care physician is not answering, I can't seem to reach them, I can't seem to get an appointment, they're using this excuse with the coronavirus that they can't see me for the next 3 weeks or listen or talk to me. If you're running into those issues, it's very important to know that Dr. Mcclelland, like she said, she cleared her Fiesta vacation for you guys. Okay. Me too. I was waiting for those chicken on a sticks, but you know, so she's ready to take your call if you need it. And please, more than ever, if you're out there and you're feeling, you know, and regardless of the coronavirus, let's just take that out of the picture. How about your everyday health? If you're dealing with diabetes, heart issues, you know, anything that you need to maintain, it's very important to keep in touch with your primary care doctor, because we want to make sure you're healthy across the board, not just preventing you from getting sick. But at the same time, you'd want to make sure that you are using these safe measures as well. And telemedicine right now is going to be the best option for you at this time until things get back to normal. And you know, you can actually see Dr. Mcclelland face to face and talk about what you would have done at Fiesta and what you would have eaten. So is there anything else that they should know? I mean, it seems so easy. Like for me, it's like,
it is. It's a lot easier than patients realize, and it's important to use these tools since we have them, because Medicare does not cover just phone visits, and new patients would have to use the app to go ahead and establish. But it's important because if we don't control their diabetes, then they are more at risk to get sick. And so now it's more important than ever because diabetics are at more risk. And so we do need to control their sugars. Labs are still open. X-rays are still open. Everybody's taking precautions. It's probably going to be a new form of medicine for probably several months until we have a vaccine. So it is important to realize we still can take care of their care in a safe, effective manner.
And that's a great point, because one thing I also do want to mention for those of you that are on Medicare and have an insurance plan that Health Texas accepts, the prescriptions are a big deal. A lot of people are worried that they can't fill their prescriptions because they can't see their doctor. Is there any truth to that? Is if they can't see the doctor in person, they can't get their prescriptions?
Oh, no, ma'am. I send in the prescriptions usually during the visit, just in case there's a problem. And so the group really encourages that. So we definitely refill their meds, and mainly saw seniors this morning and did the refills as we talked on the phone. If it's something that's life-threatening, then that's going to be a little bit different. But most things we can handle over the phone, and the patients are getting more comfortable, and we're definitely getting more comfortable doing that.
That's amazing. Yeah. And I know as an insurance agent, a lot of my customers will call me and say, well, I don't want to drive, and I don't want to go to I said, well, there's always mail order. You can definitely tap into your mail order benefits if you have any. And sometimes it's even a lot less if you do it that way. So we just wanted to let you guys know that you can still get your medications. You can still get the care that you need. You don't have to worry. The last thing we want you guys to do is stress about your health care. Health Texas is here for you guys. Dr. Mcclelland is here ready to help you right over the phone. I'm glad you helped us walk us through that, because even for me, I mean, it's confusing. You hear so much from not just the news, but the government. You hear so much stuff from other organizations that are not really taking the time to walk everyone through this process, not just for seniors, but for anybody that needs the process going over, with them. Now, again, with all this stuff that we're hearing, it's a lot of negative, unfortunately. So we tend to get really stressed out. The anxiety levels are high, especially maybe not just in seniors, but with seniors especially that are already dealing with health issues. Their stress levels are high. That's not good for anybody. What are some ways that they can, take that stress out and forget about everything?
So some ways they can do that. The gyms are now closed. So some of our patients are like walking even in their room. Some are walking outside. I still would wear a mask outside. Even in my neighborhood, we see so many people, and the majority of them don't have a mask on. Yeah. So wear a mask when you're outside, definitely social distancing. I also really think my pet has helped me through this time period. Yeah. So I have a mini French bulldog that used to go to work when I was in private practice. And so she likes to nap on me. Dogs know that there's a change though, so it distracts you because you have to reassure them that everything's okay. And I would say during this time period, some of them are going to get pretty spoiled. So try to keep the dogs on a schedule. And if you're working from home, it will keep you on a schedule. And so be careful with the treats, try to let them get their exercise. And I would, as things transition back, because it is going to transition back to a new form of everybody interacting, kind of start putting your pets on a schedule. Go to a different room, put them where they're normally at. That way you're not around them all the time, so they can kind of get the transition. So these dogs and cats and hamsters and lizards aren't acting up as you go back to work.
I am totally guilty of that. We got a new puppy, and it's so hard because she's just so cute, and she wants to lay in bed, with you, and she's just there like, feed me, mom, feed me. But yeah, I agree. The good news is my little Mila, she's kept us on a schedule. She's, but it's hard. It really is hard when they're so cute and they just want your attention all the time, especially when they're small, So that's some great advice. I really, really appreciate you taking your time out of your busy schedule. I know you're in the forefront of that. Guys, if there's anything that you need, please, please, please don't hesitate to pick up the phone and either I'm not the doctor, but I can put you in contact with them if needed. But if you want to see Dr. Mcclelland and you want to ask some questions and you need a primary care doctor that you want to establish a relationship with, Dr. Mcclelland is available for you to talk to, and she'll walk you through watch this video over and over again so you can kind of get through the steps. But if you need them to go over that with you, I'm sure there's a process that you guys will, of course, coach them through when they call you. Is that right?
Yes, we've been doing it pretty much from the beginning. And so each week we're getting better at this. And so if we're more relaxed about it, then the patients are more relaxed, and we've been very patient. And it's amazing how many of them have done so well.
That's awesome. Thank you so much, Dr. Mcclelland. Again, Dr. Mcclelland with Health Texas. Guys, my name is Victoria Cabrera. If there's anything you need, please don't hesitate to call us. And please, more importantly, stay healthy and stay positive in your attitude. And again, go get, if you don't have a pet, well, do a little bit of exercise around your home, and, it might be a good time to maybe adopt a little pet. I don't know. But so if you guys need anything, we're here to help you. Thank you so much and have a beautiful, beautiful day.
Thanks, Victoria.